In the second section of our topic, now we will discuss the acute tonsillitis. And in this section, we will discuss what are the signs and symptoms of the patient with acute tonsillitis, how we treat acute tonsillitis, and also one other term we will discuss in this section, also known as the faucial diphtheria. So acute tonsillitis, as I keep on mentioning again and again during my lectures, that acute is the disease that is for short duration. So that is present for the short term or short duration. And tonsillitis is the inflammation of the tonsils. So it's the condition which is present there for a short time, not for a long time. The components of acute tonsillitis are the surface epithelium with oropharyngeal lining. Then the crypts are present in the tonsils also, and the lymphoid tissue. Classification of acute tonsillitis: we have acute catarrhal or superficial tonsillitis, acute follicular tonsillitis, acute parenchymatous tonsillitis, and also acute membranous tonsillitis. So all these are the different types of acute tonsillitis: acute catarrhal, acute follicular tonsillitis, acute parenchymatous tonsillitis, and also acute membranous tonsillitis. So these are the classification of acute tonsillitis. And in this diagram, if you see, this is as a result of acute tonsillitis, the tonsils are all swollen and big and enlarged. They have whitish spot on them, and there is redness, erythema, and the tongue also become gray, furry tongue present as a result of. Now, depending on what are the causative factors leading to acute tonsillitis, very common condition. Lot of patients come to the ENT OPDs with acute tonsillitis, especially in children. It's very, very common. And then the ultimate recovery only occurs after the tonsils are removed and tonsillectomy is performed. So, acute tonsillitis is a common condition. The classification, we already mentioned 4 types of acute tonsillitis. Again, very, very clear picture of swollen uvula. There are the swollen red tonsils with white patches present here also. And these are swollen tonsils. Acute catarrhal or superficial tonsillitis. This is the part of generalized pharyngitis, usually seen in viral infections. So whenever there is viral pharyngitis or inflammation of the pharynx as a result of viral infection, usually it leads to acute catarrhal tonsillitis. Another type is acute follicular tonsillitis. In this, the infection spreads into the crypts. There is purulent material in the crypts. Yellowish spots are also present. You can see yellowish spots and the follicular tonsillitis, and in this, infection spreads into the crypts, and there is purulent material present in the crypts. Then acute parenchymatous tonsillitis. Tonsil substance affected, and the tonsil is in this uniformly enlarged and they are red. So acute parenchymatous. Parenchyma is the actual substance actual tonsil, which is the parenchyma. That tonsil is affected and it is uniformly enlarged and it's red. Then we have acute membranous tonsillitis. As the name shows, there is formation of membrane on the tonsil in this type. The stage, it's one stage ahead of acute follicular tonsillitis. There is exudation from crypts, and this exudation from the crypts, they coalesce and they form a membrane on the tonsils. So these are the four types or classifications of acute tonsillitis: acute catarrhal, acute follicular, acute parenchymatous, and acute membranous. Membranous is very easy to identify. There is formation of membrane on the tonsils. In parenchymatous, the whole tonsil is involved and it's large equally and it's red in color. Now, what's the causes of tonsillitis? It's rare in infants. The causes are hemolytic streptococcus. Strep throat. Strep throat is the acute tonsillitis, very common, can be diagnosed now clinically in the office by the strep throat test, which is just a very easy test performed in the office, and it gives the result right away. And then hemolytic streptococcus is the causative organism, but the less common we have staphylococci, pneumococci, or H. influenzae or Haemophilus influenzae. So the causes of is mainly the streptococcus, then we have staphylococci, pneumococci, or Haemophilus influenzae. Symptoms of the patient with acute tonsillitis, more or less they resemble the pharyngitis. Sore throat is common, very, very bad sore throat. The patient who have acute tonsillitis, they have pain even on swallowing the saliva. So it's very bad sore throat. Difficulty in swallowing. Fever is always present, high 38 to 40 degrees Celsius. Earache because of communication with the middle ear, there is even earache present. And then we have headache and constipation, which are the constitutional symptoms of acute tonsillitis. So sore throat, difficulty in swallowing, fever, earache, and some constitutional symptoms are also present. Signs of acute tonsillitis, breath is fetid, foul smelling breath. That's very common because of the infection of the tonsils. There is infection present, pus present, that leads to very bad foul smelling breath. Coasted tongue. Tongue is often coasted because the breathing is difficult. That hard breathing can sometimes lead to the coated furry tongue also, and because of poor hydration also. Hyperemia of pillars, soft palate, and uvula. So you can see these all surrounding structures, they become red and hyperemic and swollen. Red and swollen tonsil with yellow spores. Here you can see. Whitish membrane on medial surface in membranous type when there is coalesce of the purulent exudate that leads to the membrane formation. Then there is enlarged and congested tonsils, edema of uvula and soft palate, and enlarged jugulo-digastric nodes These nodes are also enlarged, and then these are very, very common signs of patients with acute tonsillitis. All the areas, palate, tongue, uvula, tonsils, they are red, swollen, their tongue is furry, enlarged tonsils and enlarged lymph nodes are present. Treatment of is bed rest is important, fluid ingestion, analgesics like aspirin for pain and fever, antimicrobial penicillin therapy is very, very important. If acute tonsillitis is not treated properly, we will later on talk about the complications of tonsillitis that can occur and that can affect the heart and the kidneys, and they can be very serious sometimes. So proper treatment is important, and the treatment of choice or antibiotic of choice is the penicillin. Complications, we have acute otitis media, middle ear infection. Rheumatic fever is in this, there is a complication, it involves the heart also. Rheumatic fever is present. Glomerulonephritis, involvement of the kidneys. Subacute bacterial endocarditis. Chronic tonsillitis can occur, peritonsillar abscess, parapharyngeal abscess, and cervical abscess. All these are the complications of acute tonsillitis. They can occur if the tonsillitis is not properly treated. It can become chronic tonsillitis due to recurrent acute attacks. There can be rheumatic fever. Subacute bacterial endocarditis can occur leading to the heart murmur. Then we have kidney involvement, glomerulonephritis, abscess formation around the tonsils and in the pharynx is also very common. So these are all the complications if tonsillitis is not treated properly. Next condition I want to talk about is faucial diphtheria or the tonsillar diphtheria. The cause is by the Corynebacterium diphtheriae. That's the microorganism that cause faucial diphtheria. Features are its commonly involved site is the oropharynx. Larynx and nasal cavities can also be affected. There is membrane over the tonsil, grayish membrane. So in diphtheria, the membrane that is formed over the tonsil is gray in color. It's not whitish membrane or it's not red. So grayish white membrane is formed. Cervical lymph nodes are enlarged. Illness and toxemic. Patient is very ill-looking and toxemic because of the toxins produced by Corynebacterium diphtheria that cause the appearance of the patient very ill or toxemic. And there is also bull neck appearance and bleeding. There is swelling of the neck, bull neck appearance, and there is bleeding also. So these are all by the Corynebacterium diphtheriae, and these are all the features of the faucial diphtheria. Complications are the myocarditis. It involves the muscles of the heart. Myocardium is the muscle layer of the heart and cause cardiac arrhythmias, acute circulatory failure, paralysis of soft palate, diaphragm, ocular muscle can also occur with the faucial diphtheria. Treatment is neutralization of exotoxin. As I mentioned, toxins are released and it's important that the neutralization of the toxin is done. dose of antitoxin by IV infusion. Then conjunctival or cutaneous tests are performed, and adrenaline and diluted antitoxin are used. Then the antibiotics that are effective, we have penicillin and erythromycin are the antibiotics that can be used for the treatment. That concludes our section 2. Thank you for watching sqadia.com.